Hello friends, welcome back. This video is a complete guide to extraction forceps. Extraction forceps are among the most valuable tool of a dentist. Forceps is the primary instrument that is used to remove a tooth from the bone. I bought these waldent forceps online from Dentalkart. These are budget-friendly forceps with a modest price and high quality. Most of the items I buy are from Dentalkart. You can choose a variety of quality supplies, compare the specifications and prices, order and receive them at your doorstep. So the forceps have three parts. The forceps have beak, that is blade handle, and they are united by a hinge joint, that is a hinge part. You need to choose extraction forceps that provide the best angle and the grip. You can see the handle design of the forceps is anti-slip. So this is an anti-slip design. Points to keep in mind while buying a forceps is that you should have a sharp beak for the effortless extraction of the forceps. For a long-lasting forceps, it should be made of corrosion resistance alloy such as a rust-free stainless steel alloy. Ideally, the whole of the inner surface of the blade should fit in the root surface. So ideally like this, it should fit in the root surface. But practically the size and the shape of the root varies so greatly that it is not possible to achieve the same. So the root is grasped by the edges of the blade and establishing a two-point contact. If there is a single point contact between the tooth and the blade, the tooth will probably crush when it is gripped. So these are the points that you should keep in mind. Mandibular forceps. The beak are at right angle to the long axis of the handle, while in the maxillary forceps, beak are in the same line, that is parallel to the long axis of the handle, and this is how you can differentiate. Each pair of extraction forceps is specific to a particular teeth or a set of teeth. The ideal solution will depend on the tooth location and the age of the patient. Now coming to the maxillary forceps, this is a maxillary anterior forceps. This forceps has beaks in approximation with each other. You can see they are very closely approximated and the handle is straight without any curvature. So this is a straight handle without any curvature. The beaks are symmetrical. They are placed in the same line as that of the handle. So beaks are shorter than the handle. This forceps is used for extraction of maxillary incisors and canines. Now the next forceps is the maxillary premolar forceps. This forceps is having beaks which are approximating each other and they are placed parallel to the handle. So you can see they are approximating to each other. They are not closed. This is an open beak and they are approximating, and the handle is having a concavity on one side and convexity on the other side. This provides a better grip and allows the forceps to reach inside more posterior in the oral cavity. This forceps is used for the removal of maxillary premolars and rarely you can use it for the upper roots. So the next forceps is a maxillary molar forceps. These forceps are paired and having beaks which are asymmetrical. You can see this is a pointed beak. So asymmetrical beak and they are broader as compared to the anterior forceps. So these are both asymmetrical beaks. This is a pointed one and the another one is asymmetrical. So it has a left or right marking that is designed according to the right and left quadrant, and each beak has a different design to adapt to the maxillary molar roots as needed. So one beak is pointed to engage the bifurcation of the tooth on the buccal side and the another engages the palatal root. So depending on the position of the pointed beak, the forceps can be identified as right or left. You can see this pointed beak engages into the bifurcation of the buccal side and the another beak engages the palatal root, which is the largest root. So depending on the position of the pointed beak, forceps can be identified as a right or a left. The handle is same as that of the maxillary premolars. So this is an upper right forceps beak engages into the buccal side. A quick tip to remember is that if beak is on the left, it makes it a right-sided instrument. So you can see the engagement, pointed beak engagement into the buccal side. So the tip to remember is beak on the left makes it a right side instrument. And this forcep is a upper molar left forcep. You can see this beak on the right makes it a left-sided instrument. Now the next one is a maxillary cow horn forcep. These are a paired forcep having same design as that of a maxillary molar, except they have beak that appears as the horn of a cow, and that is how the name cow horn forcep is given. So one beak is like a horn of the cow and another beak is pointed that goes into the buccal bifurcation, and the other beak, which is having a notch, engages into the palatal root. As you can see, this is a maxillary molar. The pointed goes into the bifurcation on the buccal side, and the another side, which is like a cow horn, goes into the palatal root. It engages the palatal root. It is engaging the palatal root. And these are the paired forceps that are used for right and left separately. So they are used for maxillary molars, which are badly carious in nature. The major disadvantage is that they crush the alveolar bone if you are using on the intact teeth. So these are the right or left side which we use separately. You can appreciate from the beaks. So the next forcep we have is a maxillary bayonet forcep, which is also known as a maxillary root forceps. So bayonet pattern forcep resembles a bayonet. This provides the better maxillary reach possible. They are primary for removing the teeth from the bony socket and with a rounded beak that contour to the lingual roots. So this forcep is designed for the maxillary roots. The beaks are symmetrical. The beaks closely approximate to each other. Beaks are narrower to fit it to the circumference of the root, and that is why it is a root maxillary forcep. Handle is having angulations so that it can reach as much posteriorly as possible. So by bayonet forcep, also known as a maxillary root forcep. Now the next one is a maxillary third molar forcep. So this forcep is specially designed for the removal of the maxillary third molar. The forcep have beak that engages the crown third molar and is having a long handle to reach the posterior region in the maxilla. This is a mandibular anterior forcep. So this forcep is having beak similar to the maxillary incisor, but these are approximating to each other. You can see the beaks are approximating and they are at right angle to the handle. So beaks are at right angle to the handle for a mandibular forcep. This forcep is used for the extraction of mandibular incisors as well as canines. So you can see beaks are approximating and beak is at a right angle to the handle for a mandibular forcep. The next forcep is a mandibular premolar forcep. It is similar to that of a mandibular anterior forcep except the space between the two beaks. If you compare both of these forceps, a space between the two beaks is present for a mandibular premolar forcep while the beaks are approximating for a anterior forceps. So this is the differentiating feature. You can see the space that is present between the two beaks for a mandibular premolar forcep. The next one is a mandibular molar forcep. These are unpaired forceps having beaks that are broader and are stout. So beaks are symmetrically pointed so that the sharp pointed tips can engage into the bifurcation both at the buccal and lingual surfaces. So beaks are at a right angle to the handle. So if you see, this is a mandibular molar, it engages into the bifurcation both at the buccal as well as on the lingual surface. And this is how you can extract a mandibular molar, by engaging the beaks into the bifurcation. The next forcep is a mandibular cow horn forcep. So cow horn forceps are best for sturdy and controlled mandibular grasp. And they get the name because when they open, they resemble a pair of horns that you might find it on a bull. So the design of this forcep is similar to that of a mandibular forceps, except the beaks here are pointed and they are conical in shape. And they also engage into the bifurcation of the mandibular molars. So these forceps are used for the extraction of the mandibular molars. The forceps works on the principle by expansion of the bony socket. So forceps creates a micro fracture in the bone by the use of these beaks which are wedge shaped. Secondly, these forceps work on the wedge principle. The tip of the forceps beak is narrower anteriorly and it is broader posteriorly. So when the tip is forced between the mucoperiosteum and the tooth, it causes expansion of the bony socket so that the tooth is displaced out of the socket. So these are the extraction forceps, and if you want to buy this budget friendly extraction forceps kit, which I also find it very nice, so I have provided a link in the description box below for you to buy these extraction forceps. So guys, if you have enjoyed the video, give it a thumbs up. Also comment in the comment section below. Subscribe if you haven't subscribed to the channel. Happy learning and enjoy your day.